Good afternoon. I'm Dr. Susan Chandler of Massey Cancer Center's Integrative Health Program. Thank you for joining us for this presentation about THC and CBD, evidence and risk. Today's speaker is Dr. Morgan Lemay. Dr. Lemay is an assistant professor of internal and addiction medicine at Virginia Commonwealth University. She practices general internal medicine and primary care at VCU Health. Researchers continue to study whether medical marijuana can help treat a number of conditions, among them appetite loss, epilepsy, Crohn's disease, glaucoma, chronic pain, and of special interest to the oncology world, nausea and vomiting due to chemotherapy. I've asked Dr. Lemay to share with us the science behind the headlines so that as cancer patients, we might be better informed. At the conclusion of her presentation, should time allow, Dr. Lemay will take questions. And since this session is being recorded, everyone will be muted and you'll need to enter any of your questions in the chat function. Dr. Lemay, thank you very much for your time and sharing your expertise in this area.
Thank you so much. So hi, everyone. My name is Megan Lemay. And I'm happy to be talking to you today about THC and CBD, the evidence and the risks. So today I'm hoping to discuss the sources of evidence and the different formulations of cannabis that have been studied. I want to review some of the evidence for THC and CBD to treat some specific conditions. I also want to talk about the known safety and side effects of THC and CBD. And then I'd like to briefly review the state of medical cannabis in Virginia. I do want to talk about some things that I won't be covering. So I'm not going to cover any basic science or theoretical benefits of THC and CBD. I'm really going to focus on the clinical evidence. So where this has been studied in actual patients and humans to show that there's a benefit or not. I am not going to give instructions on how to become certified. That's something that you would need to talk with your own physician about. I'm also not going to share individual or anecdotal evidence. So some folks listening may have individually felt that they've had a benefit from the use of THC or CBD, even though evidence may not exist in the literature about that. And that's fine. I don't wish to argue against anyone's individual experience. I just want to share what we have clear evidence for. Also, I just want to make it clear that none of what I'm saying today is medical advice or legal advice, and you should talk with your own physician if you have more questions. So this is from a site online sort of touting the potential benefits of CBD oil to treat all kinds of conditions. No other medication in the world do we have that would treat so many variety of conditions: asthma, cancer, intestinal issues, spinal cord injuries. And so I'd like to review for you today how many of these things do we actually have evidence that CBD or THC may help. THC and CBD, or CBD, I should say, is really available broadly. It's available at grocery stores, on the internet, anywhere. And so I'd like to sort of review its safety as well. So I'd like to start with a case. So this is Mr. Jones. Mr. Jones is a 35-year-old man who has no significant medical history, and he's presenting to me for treatment of anxiety. He reports that the symptoms affect his work as a medical assistant and his relationships. And he's had a few sessions of talk therapy for free through work, which have helped a little bit. He has heard that THC and CBD oil can be helpful to treat all kinds of things from diabetes to anxiety, and he asks you to certify him to receive the treatment. So let's dive into the evidence. So these are the various formulations of THC and CBD that have been studied in the literature. So when I mention studies, there's no one ingredient that's been studied. It's all of these ingredients that have been studied and put together in large reviews. Some contain THC alone, some are CBD alone, and some are combined THC and CBD. I also want to mention THCA, or which is the precursor for THC. And this is not a psychoactive substance, meaning it doesn't affect your thinking. And this is what's available legally as an oil in Virginia. It's activated by heat to be the psychoactive form of THC that we're familiar with. So most of what I'm going to be talking about today comes from two key review articles. The first is a review by Whiting, which was in JAMA, published in 2015, called Cannabinoids for Medical Use, a Systematic Review and Meta-Analysis. So in this review, they took 79 trials of either THC or CBD in one of the formulations that I mentioned, with over 6,000 participants in total. And they evaluated chemotherapy-induced nausea and vomiting, chronic pain, multiple sclerosis, spasticity, HIV and AIDS, sleep disorders, psychosis, Tourette syndrome, anxiety, and glaucoma, to see if there was evidence that THC or CBD would be helpful for these conditions. The other major review in this area is from the U.S. National Academies of Sciences, Engineering, and Medicine in 2017, and they evaluated basically all of the same conditions in the Whiting trial, plus some others. I do want to mention that the FDA has approved 2 formulations of THC and or CBD products. These are the only conditions that THC or CBD is used for, sort of on label. The FDA has said that these are safe and effective treatments for these conditions. There's a branded medication called Epidiolex, which is cannabidiol or CBD, and that helps treat certain pediatric epilepsy syndromes. And then there's dronabinol, which is approved for chemotherapy-induced nausea and vomiting, which is resistant to standard treatment, and also for AIDS-related weight loss. All the other uses are considered off-label. Just want to briefly mention the pediatric seizure syndromes, so Dravet and Lennox-Gastaut syndromes. These are not just any seizure syndrome that an adult may have, but two specific syndromes that present in childhood that can be really, truly debilitating, complex child epilepsy syndromes that are often drug resistant. In trials for these conditions, children were given CBD 20 milligrams per kilogram of their weight as an oral solution, in addition to their standard anti-epileptic medications. And there was a significant decrease in seizures for those children. I do want to note, however, that there were increased adverse events in children treated with the CBD. There was an increased incidence of diarrhea, vomiting, fatigue, fever, somnolence, and abnormal liver function results. So I'm going to go one by one to review what I find are the most common reasons people may ask me as their physician if THC or CBD will be helpful. And I'm going to take each condition one by one and review for you the evidence we have that THC or CBD may be helpful or may not be. So the most common condition that my patients talk to me about, wondering if THC or CBD will help, is chronic pain. So in the Whiting review, they were able to find 28 trials where THC or CBD was evaluated for chronic pain. I do want to point out that almost all of these studies were for neuropathic pain conditions. So this is a nerve type of pain, not just musculoskeletal pain, but specifically for nerve type of pain. The outcome that they were looking for in these studies was a 30% reduction in pain. And they did find that there was a significant reduction in pain with the use of THC. All of these trials contain THC, with the use of THC for chronic neuropathic pain. There's been one newer meta-analysis or collection of studies that looked at the same outcome, a reduction of pain of 30%. And they also found a significant decrease in pain with the use of THC-containing products. One thing I wanted to point out is that there are two numbers that we look at when we are assessing how helpful or harmful a medication may be. And those are the number needed to treat and the number needed to harm. So in this case, the number needed to treat is how many patients do we need to treat with THC for one person to obtain benefit from it. In this case, we would have to treat 24 patients with THC products to have one patient achieve that 30% reduction in chronic pain. However, the number needed to harm is how many patients we would need to treat with this for one person to be harmed or have a potential side effect. And in this case, we would only need to treat 6 patients for one person to have an adverse event associated with the use of THC. These were the adverse events that they found in the studies: dizziness, depressed mood, cognitive attention disturbance, nausea, drowsiness, thought disturbance, confusion and disorientation, intoxication, change in appetite, and respiratory tract infections were all more common in patients treated with these THC products. So in this case, we would have to treat 4 times as many patients to get a benefit than to have harm done. Just to address specifically just CBD by itself without the addition of THC, there's very, very limited clinical evidence for the use of CBD by itself for chronic pain. It's been shown to be ineffective for chronic colitis pain from Crohn's disease, and also ineffective on its own for chronic neuropathic or nerve type of pain. However, there's some limited evidence, this is more basic science research, that it may be related with cancer, may be helpful for cancer-related pain, but only when combined with THC, not by itself. My bottom line for chronic pain is cannabinoids have moderate to substantial evidence that they are effective for the treatment of chronic neuropathic or nerve type of pain. Non-neuropathic pain, like pain from musculoskeletal conditions or cancer, really has very limited evidence. CBD by itself has small amount of evidence that it's ineffective for the treatment of some chronic pain conditions. Chemotherapy-induced nausea and vomiting is another indication. So there are 2 large reviews, one from Whiting that we've mentioned, and a Cochrane review, which is another database that takes large numbers of studies and puts them together. Most of these were oral cannabinoids, like THC, including THC, versus a placebo, or versus conventional anti-nausea medication that's given with chemotherapy. Most of the trials showed that the cannabinoids were as good or better than traditional anti-nausea medication. And some showed that they were not just that they were certainly better than placebo, but better than even the conventional anti-nausea medications. However, the cannabinoids did cause more adverse events than the standard treatment, including dizziness, dysphoria, and euphoria. There's no human studies for the use of CBD by itself for chemotherapy-induced nausea and vomiting. So my bottom line for chemotherapy-induced nausea and vomiting is that cannabinoids, including THC, have strong evidence that they are better than placebo and at least as good as conventional anti-nausea medications for chemotherapy-induced nausea and vomiting. But there's no human studies to evaluate CBD by itself. Multiple sclerosis. In this large Whiting review, they looked at 2 different ways of measuring spasticity or muscle spasticity in multiple sclerosis. And there wasn't enough evidence to talk about spasticity from other sources, like spinal cord injuries, for instance. We just didn't have the evidence to review it. Specifically, for one patient-rated scale of spasticity, cannabinoids were found to have a decrease in patient-rated spasticity. In another review, specifically for neurologic conditions, it was all combination THC and CBD products, and cannabinoids they conclude that cannabinoids are probably effective in reducing patient-rated spasticity. There's no human studies of CBD by itself for this indication. So my bottom line for multiple sclerosis spasticity is there seems to be conclusive evidence that oral cannabinoids, including THC, improve patient-reported spasticity. But we don't have evidence for other reasons that a patient may have spastic muscles like spinal cord injuries, and CBD by itself just hasn't been studied. Anxiety is probably one of the other most common reasons that patients ask me if THC or CBD would be helpful. There is very, very limited evidence for the treatment of anxiety with cannabinoids like THC and CBD. So the two biggest reviews that I mentioned at the start really only included one randomized controlled trial, which is sort of the kinds of trials we use to prove if a drug is effective or not. They used not just for the treatment of anxiety, but they specifically were only evaluating public speaking anxiety. And they treated patients with a single dose of a large dose of CBD before public speaking, and were able to find that that did improve the patient reported anxiety in a public speaking setting. Other studies with lower doses of CBD have not shown any benefit. I do want to mention that there is a potential basis in lab research that cannabinoids may be helpful in decreasing anxiety, but we're just completely lacking the evidence in human studies that this is true. One of the reviews also wanted to point out that there's a moderate probability that cannabis is associated with the development of anxiety. So whereas we're really lacking in evidence that cannabinoids may be helpful for the treatment of anxiety, we do have pretty good evidence that it may be associated with the development of anxiety. A few other conditions that I'll mention. Appetite stimulation is a common one that I hear patients ask about. There's very, very limited evidence here, but specifically in HIV/AIDS patients, there's some evidence and just no evidence in other patients. For help with sleep, sleep was a secondary outcome in some of these studies that we're looking at another indication. For instance, in some of the studies looking at cannabinoids for multiple sclerosis or chronic pain, sleep quality was a secondary outcome. And it seemed like maybe it trended towards helping sleep, but it just wasn't the purpose of that study to evaluate for sleep. So we're still lacking a lot of evidence there. There's also some very small trials looking at cannabinoids for the treatment of Tourette's syndrome. 36 patients is a very, very small sample to sort of make broad clinical decisions about, but it did show a decrease in tics with THC capsules. Other conditions like epilepsy, depression, anxiety, treatment of psychosis, and glaucoma, there's just insufficient evidence. And the reviews that I've mentioned sort of also concluded that there's just not enough evidence to say if it's effective or not. So in summary, these are the conditions with the green dot, I feel like have strong enough evidence that we could say a cannabinoid product may be helpful for the treatment of chronic nerve type of pain, but maybe not for other types of chronic pain. Chemotherapy-induced nausea and vomiting, multiple sclerosis spasticity, and the use of CBD for those two specific childhood epilepsy syndromes. There is some evidence that it may be helpful for HIV/AIDS appetite stimulation, sleep disorders, Tourette's syndrome, and other chronic pain conditions. we're just lacking evidence for a whole host of other conditions, including Crohn's disease, diabetes, dystonia, graft-versus-host disease, Huntington's, Parkinson's, smoking cessation, anxiety, epilepsy, opioid withdrawal, glaucoma, and Alzheimer's disease. I'd like to switch gears and talk about what we do know about the adverse effects of cannabis use. So we know that short-term negative effects of cannabis use include impaired short-term memory, impaired motor coordination, altered judgment, paranoia, and psychosis. We also know that long-term or heavy cannabis use is associated with addiction. And I'm an addiction doctor, so this is actually one of my big worries with the expanded use of cannabis. Of daily users of cannabis, up to 10% of those patients develop an addiction to cannabis or a cannabis use disorder. And when we talk about a cannabis use disorder, we mean the patient is unable to regulate their own use. They're using more of it or for longer than they intended to use. They may have interpersonal, job, or relationship conflict related to its use. They may continue to use despite negative consequences that they've had. They may go through withdrawal if they don't have cannabis, and they may feel they've become tolerant to cannabis, so they have to use more for the same effect. So this is a big concern as I see patients with cannabis use disorder in my clinical practice, and it can be difficult to treat. We also know that especially for adolescents, they may experience altered brain development or cognitive impairment. Cognitive impairment is also a concern in older adults over the age of 65. The psychoactive or cognitive effects of cannabis may be more pronounced in that population. We know that people who are heavy users of cannabis may have diminished life satisfaction and achievement. Especially associated with smoking is chronic bronchitis. Cyclic vomiting syndrome is a rare but serious condition of recurrent vomiting associated with heavy cannabis use. And then there's also an association between cannabis use and the development of depression, anxiety, and psychotic disorders. This sort of lists some of these common conditions and how confident we are that marijuana is associated with them. So we are highly confident that use of marijuana is associated with addiction to cannabis and other substances. Medium confidence about that abnormal brain development, progression of use to other substances, schizophrenia, depression, anxiety. Highly likely to result in diminished life achievement and motor vehicle accidents. And chronic bronchitis, low likelihood, we just don't have evidence really that it's associated with lung cancer. So all of that was for cannabis, which includes THC and CBD. For CBD by itself, we have several in vitro, meaning in the lab, and in vivo, meaning in humans, studies that show that THC has a safer profile. It doesn't seem to have an effect on heart rate, blood pressure, body temperature, gut transit, or psychomotor or psychological functioning. Some of the studies have shown that CBD may be associated with something called orthostatic hypotension, which is low blood pressure upon changing position or standing up, dry mouth, diarrhea, vomiting, fatigue, and elevated liver function tests. CBD and actually THC as well may have drug interactions, so I would really encourage anyone who is using THC or CBD, either recreationally or medically, to speak with a pharmacist about potential drug-drug interactions between those. This is not a comprehensive list of the potential drug interactions. I also want to point out the potential variations in products. So this is from a study where the researchers purchased CBD from 84 places that were selling CBD online in 2017. So this is not from a pharmaceutical dispensary. this is purchased from the internet. 42% of the doses that they labeled were under-labeled. 29% were over-labeled. So people were either getting more CBD or less CBD than they thought. And this is concerning to me, 21% of the samples had THC detectable in them. There have been case reports of people who work in healthcare, for instance, where we are potentially drug tested, who have used CBD and actually lost their jobs because they thought they were just taking CBD, but they're allowed to have a small amount of detectable THC in the samples, and that could potentially be enough to show up in someone's urine and unfortunately have a really big negative impact for that person. So I now want to share a little bit of information about the state of medical cannabis in Virginia. So all of this is from the Virginia Department of Health Professions Board of Pharmacy. None of this is legal advice or medical advice, and it may not be complete. So please think about referring to the Department of Health Professions website for more details and information. So in the 2018 and 2019 General Assembly sessions, there was a medical cannabis law passed in Virginia that allowed the creation of 5 medical cannabis processing facilities that were originally expected to open mid-2020, and that did happen, but sort of later in 2020 in general. And this allowed Virginians access to therapeutic strength, Board of Pharmacy regulated cannabis, THCA, and CBD oils after receiving approval from a doctor, PA, or NP. It's not a prescription, so this isn't something that your physician would write you to take 600 milligrams of CBD daily. This is a certification that you can potentially receive from a physician that provides what's called an affirmative defense if a patient is found in possession of cannabis. I'll talk a little bit more about what that means. So there are 5 health service areas in Virginia, and each of them was allowed to create 1 pharmaceutical cannabis dispensary. So what is the written certification? So a practitioner, either a physician, NP, or PA, can issue a certification that their patient has a condition that may benefit from the use of THCA or CBD oils. It doesn't give a limit on what those conditions may be. It's just if that person feels that there is a benefit, they can certify a patient. The law then provides an affirmative defense for that patient to possess a CBD oil or THCA oil if they have registered with the Board of Pharmacy website and maintains a current registration. So THC remains illegal to possess at the federal and state level. However, this certification, should someone enter legal trouble related to possessing THC or CBD, this would provide them a potential defense for why they are possessing it. That law is likely to change in Virginia based on the most recent General Assembly, but at the federal level, it remains an illegal substance. So patients, in order to have their provider certify them, need to register with this website and pay a $50 initial fee and $50 thereafter. Providers also have to go on this website and register to be able to certify patients. So I'd say the majority of providers I know have not registered in order to certify patients. So I didn't know a lot about what the process is actually like for patients. So I actually called G-Leaf, the dispensary in Richmond, and they were nice enough to sort of share with me a little bit of what the experience is like for patients when they go there. So the first time that a patient would go there with their certification, all patients consult with the pharmacist on their first visit, and the pharmacist reviews the patient's medical conditions and medications to look for contraindications to the use of cannabis. And for instance, they would consider a current psychotic disorder to be a contraindication to taking cannabis because of the risk of psychosis. They also check for drug-drug interactions. They review the symptoms that you hope will be alleviated with cannabis products. And then based on all of that, they recommend certain products to you. They recommend either THC or CBD or a combination. And there's a variety of different products that they may recommend. And the different products, they say may have various benefits based on something called a terpene profile. So a terpene is an organic compound within cannabis that provides the cannabis specific flavor or aroma. This is from a site called Weed Maps, but this is also the pharmacologic review of, this is all at the basic science level, not tested in humans, but at the basic science level, each of these different terpenes may have different effects based on how they grow the plant. Certain plants will contain certain terpene profiles versus not. Some may have more effects on brain function, appetite, pain relief, sedation, and breathing. Again, this is basic science research. None of this has been proven in studies with humans. This is sort of a theoretical effect of a terpene. So the pharmacist will help you choose a product, and they have various products, all from oils, vaping, dabbing, tinctures, edibles, and the pharmacist will provide you instructions on dosing, how to use the product, how often. A patient may purchase up to a 90-day supply, and cost varies by product. I don't have specific pricing information, but they did share with me that the average customer spends about $220 for a 2-week supply. So with all that in mind, I started with a patient that came to me, Mr. Jones, with anxiety, asking me would I certify him for treatment with THC or CBD. I don't have all the answers, and my goal today is not to provide a yes or no answer. But I will share that specifically for anxiety, we're lacking a lot of evidence. So can I with good conscience say that THC or CBD would be helpful for his situation? I'm not sure that I could. In addition, we do have lots of evidence-based treatments like cognitive behavioral therapy and well-studied and established medications that are helpful for anxiety that Mr. Jones hasn't tried. So for any condition, I would probably note that we want to make sure that the evidence is there, that it really may be helpful to treat the condition, and that other evidence-based treatments haven't been overlooked for the use of a cannabinoid. So in conclusion, there have been multiple formulations of cannabis studied with various endpoints and outcomes. There's strong evidence for the use of cannabinoids to treat chronic neuropathic or nerve type of pain, chemotherapy-induced nausea and vomiting, and patient-related scales of MS spasticity. Epidiolex is an oral CBD formulation, which is FDA approved for Lennox-Gastaut and Dravet syndromes. Cannabis is associated with several adverse effects, with short and long term, including addiction. CBD has really limited evidence for its benefits, but also some limited evidence that it is relatively safe in humans. And for questions or details about medical cannabis in Virginia, I would really encourage people to visit the Virginia Department of Health Professions website. And with that, I will take any questions.
Well, Dr. Lemay, thank you. That was very enlightening. I really appreciate you sharing the science, which was one of the goals, and increasing the awareness, as well as highlighting the available resources through the Commonwealth of Virginia. One of the questions we had was, what's the biggest myth that you seem to encounter in your practice?
What's the biggest myth? That's a great question. I think the most common one of the most common reasons that somebody comes to me hoping that THC or CBD will be helpful is a mood disorder, either depression or anxiety. And I think the myth, is that it's a well-established treatment for these conditions, when in reality it just isn't an established treatment. I don't wish to argue against anyone's individual experience. It's just as a physician, we're making decisions based on evidence, and in this case, it's really lacking there.
I recall being at a conference in New York about 2 years ago where there was a good deal of, there were a good number of studies about THC and CBD being presented. But the bottom line at the end of the day, it was always, we just don't know. There haven't been enough studies. And as I heard you talk about the drug interactions, the potential for drug interactions, that's something I've really not given much thought to. And certainly many of our oncology patients, may have other comorbidities or other chronic conditions that they're being treated for, obviously with prescription medications. And so I think you raised a very valid point there, and always letting your physician or your pharmacist know. Can you speak a little bit more about that?
I completely agree. I think people can sometimes be a little, worried about sharing that they're using cannabis products with their physician or pharmacist because they're worried about being judged for it. In reality, the only reason that we as physicians care about if the patient's using a cannabis product is their safety. Just wanting to make sure that they're well, that we're monitoring them for any potential negative effects and checking for those drug interactions so that we know if maybe not to use certain medications for them, or maybe you'll need a higher or lower dose of a certain medication if you are a regular user of cannabis. So I completely agree that it's really important for patients to be upfront and share. And I hope that we as physicians in the medical community try to make it easy for patients to feel comfortable sharing that with us.
Yeah, excellent point. I think that there's a lot of discomfort in terms of fear of being judged, and that may lead to the reluctance. Yeah, you raised another very important point when you talked about variations in product contents, that 42% were under-labeled, 29% were had over the amount labeled, and 21% had THC, which it wasn't even supposed to be in the product. Another great awareness for patients.
Yeah, and I do want to point out that none of those products, and I think I said this, but just to reiterate, none of those products were from a pharmaceutical dispensary. And so the regulations for our pharmaceutical dispensaries in Virginia are much greater than Joe Schmo's CBD shop on the internet, which is great. But even our pharmaceutical dispensaries, products that are CBD only still may contain a very, very small amount of THC. And it may not be enough to be clinically relevant, meaning may not be enough to change your sensory or thinking, but it could it be potentially enough to show up on a drug test? I don't know. And so if the stakes are very, very high for somebody to end up with THC in a drug urine sample, then I would really be cautious about using even CBD products.
Absolutely. I was not familiar with written certification, and I'm going to make the assumption that a lot of our listeners are not that aware of it. That was interesting, the process. And as you pointed out, I believe that not that many it's not that prevalent among doctors at this point in time that they have registered.
That's true. Yeah, I only know a very, very small handful of physicians or nurse practitioners who have gone online and registered to provide the certification. The written certification is absolutely essential for anyone to purchase cannabinoid products from any of the dispensaries in Virginia. So that's sort of the formal process that is in place. Physicians and nurse practitioners won't provide prescriptions, but they can provide a written certification if both the patient and the provider are registered.
Right. Yeah. And I wasn't aware of that concept of affirmative defense either. Interesting. As you pointed out, that of course it's still illegal on a federal and state level. I was also very surprised at how expensive this could be. If a medical dispensary can provide up to a 90-day supply, and we're looking at $220 for a 2-week supply, this is not inexpensive at all. And it's all out of pocket, I would assume, for the patients.
Yes, it is completely out of pocket. Insurance does not cover this in any way. So the one thing that's interesting, just anecdotally, from having a patient who I didn't certify, but who separately has his certification, told me, he can purchase a 1-month supply, but that's as if he's really using that every 4 hours, or as frequently as he may want to use it. Where in reality, maybe he's only using it when his pain is really severe 2 or 3 times a week. So a 2-week supply may end up lasting the patient much longer than that, depending on how often they're actually using it.
Good point. Very good point. Yeah, and then finally, I was really, it was very disappointing to hear that, so many people think of marijuana use with a cavalier attitude. And that's not a judgment, that's just an observation. But your experience with long-term or daily use resulting in a 10% going on to develop an addiction that really impacts their quality of life. And after all, we're wanting to use this product actually to improve quality of life, particularly for those people who have chronic pain or chemotherapy associated nausea and vomiting.
Yeah, that's probably another, maybe tied for the biggest myth actually, is that marijuana is not addictive. Cannabis use disorder is a recognized condition that I treat every week. Patients with cannabis use disorders. So I, as an addiction doctor, it's truly one of my biggest worries about the expanded access to cannabis products is the increase. Just as alcohol is a legal substance that people can purchase, and most of the United States probably uses, and a portion of those patients using it legally will develop an addiction to alcohol or alcohol use disorder. It's similar idea with cannabis. Most patients will not develop a cannabis use disorder, but a certain percentage may. And that's a concern.
Of course. Well, Dr. Lemay, this has been so enlightening. I know that it's increased my knowledge. And I hope that our patients at Massey Cancer Center who have viewed this and listened to you have found it just as helpful. And thank you so much again for your time and your expertise.
Thank you so much for inviting me. I really appreciate it. Thank you so much.
Certainly.